Hello, my name is Gilda Grobe, and I will be talking about the effects kinesio tape has on the knee joint. In this presentation, there will be information in regards to the benefits, if any, that the kinesio tape may have. A little bit of background: this kinesio tape is something that is relatively new. It was first popularized in the 2008 and 2012 Summer Olympics, and eventually it was quite popular because of the benefits it claimed it had. Some of those benefits were correcting alignment of weak muscles, helping with joint motion, and with increasing blood flow. So of course, this led to think, if this kinesio tape can help with joint motion, and these are some of the areas that athletes would wear the kinesio tape and apply it to themselves. This study is focused on both male and females who have been diagnosed with osteoarthritis of the knee. And according to the American Academy of Orthopedic Surgeons, osteoarthritis is the leading cause of disability all over the world, as osteoarthritis can involve all the joints, but more specifically the knee joint, which helps us with walking. And this type of disease can also result from aging, injury, and wear and tear. So why is there an issue? Well, to begin, most people know osteoarthritis and its association with the wear and tear of the knee, causing pain, decrease in movement, decrease in walking, extending, or flexing the knee. All around, it can affect the activities of the daily living. And more often than not, people want to be able to get up and move around and perform simple tasks without the need of crutches, walkers, canes, or a wheelchair. And this is an example of the knee. This is a normal knee. As you can see right here, there is a spacing. This is the knee joint, and in there is cartilage, the meniscus, and that's with the shock absorbance aspect. And as mentioned, aging and wear and tear can cause that to pretty much have bone on bone. And right here would be an example of osteoarthritis, osteo meaning bone. So this led us to think, what effect does kinesio tape have on the range of motion in the knee joint? We wanted to know, will this help? Will it not? And these are some of the questions that heightened our curiosity. But it is hypothesized that there will be no considerable increase in range of motion when using kinesio tape. For this study, this was based on 4 weeks, and some of the methods used were based on 60 participants, both male and female, who ranged from 40 to 65 years of age, and were randomly assigned to 2 groups, the experimental group and the control group. The experimental group will have the kinesio tape applied with tension at the quadriceps, while the control group will have no tension, giving the illusion that they do have the same treatment being applied to them. This is an example of the kinesio tape with tension. It starts at the anterior aspect of the knee, of the leg, right above the knee, and tension will be applied going down, and then the participants in the control group will not have the tension. And in addition to this, at the beginning of the test, their knee joint will be measured via a goniometer, and it is a little ruler type that will help measure the degrees of flexion. In this case, so the knee is flexed, then it's probably at 90 degrees. If it were to be extended, it will be completely straight. In addition to that, there will be a test called the Lewinsky Index Score, which is essentially a questionnaire that is asking about their activity levels, such as what is their maximum distance that they can walk without pain, or do they have any stiffness. And for our statistical analysis, there was a pre and post test design that was used to analyze the data. and it was conducted to compare the range of motion of the knee joint, and which one group who was using the kinesio tape with tension and the other one was not using anything. It was essentially sham tape because it did not have any tension applied. For our results, the gain score was completed, and there was comparing between both the experimental and the control group and on averages of the changes it had. It essentially showed changes were on the extension of the knee joint, but based on that, there was not enough information that demonstrated that there was a difference. So our results concluded that it was not statistically significant. And here, as you can tell, these are our control group, how it was pre-test at 45 and post-test is negative. I mean, it was at 10 degrees. When extending it, we want to make sure when it's full extension, it is pretty much at 0. And if you're having limitations, then you'll start having some of those degrees fluctuate. So at the end of this, it's because the results showed that there wasn't statistically significant. There needs to be further research as far as will there be an additional factor that needs to work with the kinesio tape to increase the joint's functionality. Such as, does therapy need to be included with the kinesio tape to give it more benefits, or will they need an additional thing? Will they need steroid injections? I mean, or is it only for patients who have osteoarthritis, or is it for something else? Will it also help people who have meniscal tears or ACL tears? So essentially, there still needs to be more information for us. So thank you.